Grant Engine. Thanks, Dan. Really pleased to have everyone here, and we'll have folks joining on the waiting room as we come. So we'll get people going through. Just a quick programming note. I'm really pleased to have Rich Bendis, the CEO of BioHealth Innovation, with me. If you didn't hear before, there was a late-breaking change in his schedule, so he's coming at us real time as he is driven from Kansas City to the East Coast. So really excited. We've got some great content for you this morning. The parameters of today's webinar is there's no press allowed. So if you are a member of the press, please make yourself known and please remove yourself. We are obviously recording the call, and we will ask for questions as we go. And if you want to put those in the chat, we're going to answer them in the latter 15 or 20 minutes that we've got for the webinar. But if you want to take them as we come, that'll help us. And we'll be able to categorize them as you're bringing them through, and we'll capture them at the end. So I'm going to share my screen, and I'm going to go first, and then Rich is going to join on his side. And if you can see this screen, let's make sure this is working. There we go. Can you see that screen, Eric, Dan?
Yeah, you might want to go to PowerPoint.
Yep. Yeah, is that, so you can see that, Eric? Yep, okay, great. We're gonna talk about a quick overview, really give an update on funding and the outlook of where things are, spend a good amount of time talking about that, and then we're going to talk about long-term funding strategies as well, some playbooks that we've seen reliably work for our clients and out in the marketplace. And if we have time, if questions come up, we'll do a background on Grant Engine. Just a quick snapshot. We are based in Chapel Hill and in New York City. We're really in this business for you as our clients to help bring differentiated products to market towards the mission of saving lives and extending the length of a quality life. That's why we do what we do. That's why we're here. And I'm particularly pleased to have Rich and John and the team from BHI here, because we're going to talk about the funding environment and how to get funding. And in combining with BHI, their real business is helping companies advance and commercialize their technology and bringing those products to market. And there's a reason why we have BHI as a partner, is that's really their activity, and their role is to help bring products to market. So it's a good combination, we feel, here on today's call to get money, and then how do you build it to get it into market. We have one of our big edges is we've got a win rate of 2x to 4x better than the national average. And we've got 4 big reasons why that win rate is what it is. The biggest reason is our team. We've got 3 other really important reasons that make Grant Engine a unique and highly effective partner for you in your funding journey. Quick snapshot on upcoming events. We'll be at Bio next week, Monday through Thursday. Pretty packed calendar already with 52 meetings, but we definitely have time. And if you're interested in meeting with us at Bio, please email zacharysteen@grantengine.com, or I am also available to email me directly. We've got a Denver event going on June 24th, and then we're hosting a private dinner on the 26th of June in Boston for chief medical officers. So that should actually say Boston, not Rockville. So I wanted to just set the stage as we think about where we are as a country, as a group of companies in our broader community. And if this is a quick snapshot of, I think, the potential that we have ahead of us. And there is definitely turbulence in the marketplace. And I think if you're a student of history, as am I, you will have been aware, or you know about this 6-volume book from Edward Gibbon about the history of the decline and fall of the Roman Empire. And the central thesis of this book is that empires fall when they lose the internal strength and the cultural cohesion that make them great. External enemies can do lots of things, but they can only defeat a country or an empire that has already hollowed itself out from within. So it's in our hands to be successful. Contrast that with John Winthrop, who wrote a treatise before America was really formed, A City Upon a Hill. This was popularized during Reagan's administration, where we can be the city on the hill. And that's meaningful because it captures this idea, this spirit, this imagination of, and it captured it then, of American exceptionalism before America even existed as a country, that a new society had spoken in those words, a divine mission or higher calling to model effective living. And this country has endured as a symbol of national purpose, moral leadership, and the weight of public example. And the reason why these are relevant, in my view, for us is that we have the future ahead of us. And we at Grand Engine, we at BHI are all using public money. This is your tax dollars at work. And I feel strongly that we all have a responsibility to use those funds to get product into market and improve the outcome, improve the standard of care for patients, for the warfighter, for our broader society. And so the future is up to us, and ultimately it's up to you. And I'm speaking to you as a current client, prospective client, inside the Grand Engine team, inside the partnership at BHI. It's up to all of us to use that money and use it well, so that we can continue to be that city on a hill. There's an opportunity ahead of us, and the future's not written. We get to write it. So this is a call to action for us to write it. Want to ground us on what's going on? What does that mean for you? And how do you react in this federal funding environment? So I'm going to walk through, hopefully quickly, in the interest of time, a few key slides about what's going on in the NIH and broadly in the U.S. government in terms of funding. The first point is that if you just look at longitudinal win rates, and the NIH is very good about publishing these overall, we really focus on the SBIR STTR program, where if you're tracking this, the win rate in fiscal 24, government year fiscal 24, which ended in September 30th of 2024, the win rates are the lowest they've ever been for the SBIR STTR program. And so just to amplify that, we're at about 10% phase 1, 18% for phase 2, broadly capturing phase 2, phase 2Bs. Those are the lowest that program has ever been. And that really was driven, if you think about the numerator of awards and the denominator of submissions, a lower approval rate can be driven by a greater denominator, more submissions. And that is, in fact, what really was driven. The budget amounts were generally the same and up a little bit in 24 versus 23 to reflect inflation. But the denominator of the total number of submissions is what drove that win rate, a total approved rate, lower. And that volume was up in terms of number of submissions about 24%. Approval rates were down about 37%. And there's one big reason that we have seen and heard why that was. And broadly speaking, I think there's an interest in government funding that certainly provided some lift. But there is also a significant increase in volume due to AI. And that's probably the biggest driver of 2024 volume going up. Quality still matters. And those grants that had quality in them that were competitive got awarded, had a greater chance of getting awarded. What I found really interesting to underline this point, we've got visibility on our fundable scores that we track as an impact score of 29 or below. We had the highest number of those projects in 2024 than ever before. What we also find interesting is that the number of notice of awards is always higher than our impact scores of 29 and below. So I think so we don't know, 2024 is not yet fully played out in terms of what got awarded, what didn't get awarded, but there's a very clear pattern that quality matters and that quality can make a difference in your outcome. So that's 2024. What's also really interesting is that in the January SBIR submission and in the April submission, we're hearing primarily from inside the National Institutes of Health and from reviewers that are sitting on study section, is that submission volume in 2025 is down significantly. Reviewers are reporting volume that's 1/2 of what it normally is. NCI reported out that they received 1/3 as many submissions as they usually do in the April cycle. And that, combined with point number 4, is that the continuing resolution was passed on mid-April of this year, putting the federal budget for the NIH in this fiscal year ending in September 30th at the same levels of 24. So there's a lot less submissions, but there's the same amount of money. And this is a theme that you'll hear pretty consistently from us, which is if you stay the course and consistently submit quality applications, you have a good chance of finding success. And now in fiscal 25, a greater chance of success because there's a lot of concern. There's a lot of worry in the marketplace. That makes total sense. You'd be literally crazy to not be kind of worried about what's going on with our federal funding. But the reality is that those companies that stay the course, that submit, have a greater chance in 2025 of getting funded. And because many companies are not staying the course, they're worried and afraid. And that means that your chances are better because they're staying off the field. They're just not submitting. And so this is a very telling example. And I think if you roll back the clock of saying, well, if I knew that in September or October of 2024 of what 2025 was going to look like, then I would be submitting, right? The budgets are the same and there's fewer submissions. But we can't go backwards. We can only go forwards. And what's going to happen in the forward year to 18 months is that we'll talk about what budgets might look like. We don't know what's definitively going to happen. We are predicting there's going to be a plus and a minus and a plus. But if you don't stay the course, you definitely have no shot of getting funded. And because of that fear, others may not participate, and that creates a greater opportunity for you. So just like you wish you had done, presumably, in a better supply and demand equation with you have a greater chance of winning, you were interested in funding for the January, the April submission cycles for 2025. That same applies for September of 2025, January of 26, April of 26. We don't know what's going to happen, but those companies that stay the course have a greater likelihood of enjoying an easier win rate. So those are reliable. We wouldn't say this if that wasn't valid. A couple other data points that we're hearing from the front lines is that April proposals are being reviewed centrally through CSR, not by institute centers individually. That's a revert from going back to the way it normally is. And then reviewers more and more are being guided and trained to evaluate the commercial potential of the project. And there are more clinicians on study section. So the real world application of your product to improve the standard of care, to drive improved outcomes matters more and more. That's another reason why BHI is on this call. That's another reason why we write grants from individuals that know the field so deeply. But I think at the end of the day, this 3 and 4 are what matter for the future. I'm going to try and speed things up here a little bit. A couple of updates if you have not. Oh, thanks, Dan. Yeah. So we're doing a quick poll of where do you think your budget is going to be? Sorry, the budget that agencies that you are going to submit to, what percentage do you think the cut will be? And that's a little bit of a preamble because we've got the budget here on a slide up ahead. So we'll preview that. And maybe after I get through this slide, Dan, let's do those poll results. So this slide just speaks to the changes that are happening where BARDA has come off of the being underneath ASPR, and it is now nested with ARPA-H as part of Office of Healthy Futures. Dan, let's see if we can clean up that line, please. There is a proposal that is looking at collapsing the National Institutes, those 27 institute centers into 8 institute centers. And then there's a lot of the grouping that was under CDC that's now under a new agency, Administration for a Healthy America. So definitely a reorganization on that. This is the budget that was proposed. So let me go through this and then we'll go to the poll results. This is the budget that was approved for by the White House through OMB. It is now working its way through Congress as a big, beautiful bill. This calls for a pretty significant reduction in many areas. NIH is looking at a reduction. The worst case is if this gets approved from a budget perspective, of a 40% drop from about 47 billion to just under 27 billion. NSF also gets cut, and many other things get cut quite substantially. And so that's, I think, a worst case. And so these poll results, we had 58% people reporting, about 41% said it's between 30% and more. 20% or a fifth said between 20 and 30% cut, and another fifth said 30% said about between 5 and 20% reduction. So I think this bill has not, the big beautiful bill has not become law yet, and we'll see how that goes. So yeah, Dan, that's helpful. And this is the potential. Let's pull those results back. You can see here the grid of the National Institutes of Health of where those can go. One quick update is on ARPA-H. So we've talked with administrators there, and we've seen some implications of DOGE and what's happening there, and how that is riding itself out, and just how ARPA-H, as one of the larger institutes, is responding to current budget environments. And so the two big things, and we know Jason Roos, we met him in person last year, and we've really become quite embedded with certain program managers, and we've got access to many of them. The big things that are happening at ARPA-H is the director is playing smart and acting quite conservatively. The projects that are being reviewed right now are being all reviewed by DOGE. And that was the case about 6 weeks ago. We haven't gotten an update since Elon Musk left DOGE, if that's still happening. But what we're hearing from other corners of the government is that DOGE is still very much there and playing a part. They're reviewing all spend, and budgets that used to be in the $25 to $40 million range are now closer to 10. We are tracking projects, and they're really looking at specific milestones that are in the weeks versus quarters, and tracking on specific milestones that need to be tracked in that that very discrete manner. So taking big leaps via small steps is really that mission. We are tracking all 17 program managers that have roles and missions, but have not yet announced a program. So that's an area that you can dialogue with us on. And let me ask Dan if you can do the second poll now about how important big funding is for you, and where that sits for you in the total stack of where you want to play. So as that is going, we'll report out on that poll here in a moment. Let's give it another minute, Dan. So given the ups and downs and the ins and outs of what the federal budget could be, and what implications it might have, I've given you some potentially very challenging news. The first thing that you want to do is expand the volume and diversity of your sources of funding. Generally, we think about there's 4 large buckets to go after: federal, state, nonprofit institutions, and then non-US sources. Expand where you want to go, and leverage as many applications that you can that are high quality. So you want more quality submissions, and of those submissions that you go after, be persistent. I think one of the greatest opportunities is to stay the course, and continue to stay focused on submitting quality applications. And to not participate, you drive yourself an assurance of not getting funded. And if everyone has that perspective, like they have had so many people, majority of folks, companies that typically would submit have not, you're going to enjoy a better chance of getting funded. You want to broaden and diversify your relationships, and be mindful about new rules on the payment management system. Right now, DOJ is reviewing every invoice. There has to be additional documentation of what an invoice is for, and sometimes that's slowing to a week or even 2 weeks to get that paid. We are well versed in how to navigate that. So if you have interest or needs around the manage side of this, we're there to support you. And there's a tighter scrutiny on foreign risk assessments. So that's very important to know going in. We've got a very effective blog. If you just Google foreign risk on our website, that blog will, if you do a search on our website for foreign risk, that blog will pop up, and you can navigate case studies from the NIH, the actual just-in-time form. That's a very useful piece of information of where to go. So we have solutions across the board in terms of find, win, and manage that are very useful. So I've given you some tough news around budgets. We don't know what that's going to end up looking like, and but there's still real money here. Let's look at the results from the poll. So yeah, 51% of people say significant funding over 5 million is either important and a priority or mission critical. And 41% there's possible interest, and 8% said it's not important. So we've got over 90% say it's interested, and over 50% saying it's a priority and it's mission critical. We have a meaningful portion of our team dedicated to significant, big, non-dilutive funding. We've got a dedicated individual in Eric Tam, who he'll put his email address in the chat. That's his whole focus of helping companies secure that. We've got a number of partners that help us do that. So I've given you some rough news. Thanks, Dan. Let's pull that one down. And then let's also pull up poll number 3, which is the last poll. I think I want to just touch on some good news. So this is, if you'd like Grant Engine to reach out to you, and if so, where and how. The good news here is there's also a bill, if you happen to have read Project 2025 on page 755, there is a bill that is being circulated that follows that call from Project 2025 that calls for an increase in the SBIR allocation. From today, it's 3.65%. The bill, which interestingly is being sponsored by a set of Democrats, is a call to increase the SBIR allocation to 8%. That is not a small increase. That's over a 100% increase. And there's also this bill talks about making that SBIR program permanent versus a 3-year renewal. That would scale in over time to grow to that percentage. But there is hope. There is good news. And I think at the end of the day, we don't know how things are going to shake out in terms of what the big, beautiful bill gets approved at for reductions, if any. And we don't know if this bill is going to get approved. But I can tell you one thing, Grand Engine is committed to your success. We have navigated success in a the most difficult win rate environment. Last year in 24, we had our best year ever in a market space that had the worst approval rates on average. And we do that because really our top flight team is deeply capable and can deliver. And we're here for you as a client to help you support that. So, yeah, Dan, we got a lot to cover, and I'm really going to put a placeholder in for these strategies. Looks like a meaningful number of folks are interested in a mix of smaller opportunities to great. So that's great. We'll follow up with you individually. That's good. I'm over time, but I just want to touch. These slides will be available and certainly will be sent out to you as well as posted up on the landing page for the website. But we've got in detail here 6 strategies that are long-term in nature, and they are starting small and slowly growing bigger. Called the snowball effect. Those can be a small opportunity and it can be quite big over time. Finding a rock star in a collaborator or a strategic partner that is a bell cow, is someone that people listen to and has authority in the voice and a voice in the market space, adding them to the mix and being collaborative is a very effective way to up your notoriety in a study sections that are still widely populated by academics. Always staying one step ahead. This means using existing money to generate preliminary data for your next application and not having to chase your tail. Always living in that chasm of gap between grant awards. A platform applies to a company that has a product portfolio or a platform. There are multiple products can be applied for. Go deep on one, get success there, and then do it again and again and again. We've seen this successful quite a bit with our client base. If you've raised equity or want to do that, you can go after grant funding, and when you get an award, that frees up equity to work on other things to extend your runway or diversify your portfolio. And for those of you that have product that can be developed and hit the market in 3 years or so, there's this concept of a virtuous circle. You get SBIR funding, you progress it, you make a product, bring it to market, show success, and that really is the whole point of the SBIR program across the board and really government funding writ large. So we'll have detailed slides on each of these, as you can see up on the slides. And I just want to finish with the next steps. If you're interested in working with Grant Engine, we would receive a product development funding survey from you. We like to do that under an NDA to protect your information, but that's really your call. But we need that product development funding survey to understand your product and its differentiation. then we take that and pair it with a subject matter expert, do meaningful prep, and then spend about an hour on a call with you to discuss the competitiveness and the viability of your project and program. So that is all complimentary and very useful for your benefit, and gives you some insights onto your trajectory in any scenario. So that's what we wanted to walk through from my side. Again, those slides will be available as we wrap up. With that, I want to first to Rich say, appreciate your patience. I went a little long, but as I started with, we're here to get clients funding, and Rich and team are here to turn that funding into commercialized products to impact the standard of care. So with that, I want to turn it over to Rich to walk through his slides.
Sam, thank you very much. Thank you for the invitation to be on the webinar with Grant Engine today. You had a great overview on basically the services you provide, where the budget is currently, and best guesses of what we can look to in the future. But I guess the question is, for those who have good technology, good research, want to get into the market, how can we accelerate the commercialization and go-to-market strategies to assist in getting to the market and be a first mover with your technologies? And I'm going to basically talk a little bit about BioHealth Innovation, which many of you probably don't know, with a brief introduction, talk a little bit about our unique entrepreneurs in residence. And we have a national network of almost 40 EIRs who are experienced in industry and in the market and in venture capital, working with early stage life science companies to help them with their commercialization, and then talk about a few next steps. So, and John Nelson, who's our client service manager, is on this call with me. And as Sam mentioned, I'm actually driving through Indianapolis right now. I have a great driver, which is my wife, driving us, and we have a great cell. So I'm hoping the cell will stay strong as we go through Indiana and go through my presentation. So John, basically BHI, BioHealth Innovation, I was the founder in 2011. And it was actually created because there were a number of fantastic assets and resources in Maryland, including NIH, FDA, HHS, CMS, Johns Hopkins, the leading research university in the world, plus a number of research-based companies. But it was known as a research region, not a commercialization region, or basically great R&D was being conducted, but you didn't see a lot of the products getting into the commercial market. So BHI was created and founded to be an acceleration engine to work with existing and progress their technologies and find out if there is a valid market for them to enter. Next, John. As I mentioned, we're a private-public partnership, 501c3. We view ourselves as an innovation intermediary, which means we don't have to control everything, but we really need to understand what are the appropriate connections, networks, and assets that you need to be connected to in order to progress what you're doing with your company. In addition to being a subsidiary and actually own about equity in about 27 companies. So we understand the dynamics of early stage companies who are looking for non-dilutive and equity capital to grow. Basically, we were formed to look for helping create solutions in the innovation economy, especially in the biohealth industry in our region, connecting regional and national assets, developing the entrepreneurial pipeline, attracting, as I mentioned, both non-dilutive and equity funding, and really trying to identify commercially relevant technology at the federal, academic, and at the industry level that we could assist in their commercialization efforts. Next. The other thing about ecosystems, and all of you belong to some type of an ecosystem in the area where you are, regardless of whether it's rural, urban, established, or not established, is you have academia, industry, government, and foundation and NGOs, all who are trying to develop or progress life science technologies. Sometimes partnerships and collaborations are better, but what you have to find are common, inseparable missions that bring you together to work in a collaborative fashion. That's really one of BioHealth Innovation's roles, is to be that intermediary in the middle to try to create the collaboration, identify where there are strengths and weaknesses that by bringing parties together, it will be a stronger solution to enter the market. Next. We are very industry and market driven. We do not have any government officials on our board. We have a 25-member board. 22 members are from industry, large and small, venture capital, large bios, some service providers. You'll see a lot of familiar logos there of global brands that are represented on the BHI board, which all give us access to their networks, and they volunteer resources to help us with our mission of this accelerating commercialization of biohealth technologies. Next, John. Generally, if you look at where technology research begins, it begins on the bench in the lab, whether it's entrepreneurial firm, academic institution, large pharma, bio, medical device companies. We tend to find our sweet spot is not really in the early proof of concept stage. It's where it's really the proof of commercial relevance, where you've already identified there's a market, there will be market pull, there is something that works, you've already tested that past the proof of concept stage, and you've identified that there's a market out there and a buyer who will buy it. And it's also scalable. So when you're looking at trying to commercialize your technology, whether it's a strategic partner you're looking for, or a private equity firm, a venture capitalist, or you're even trying to exit, all of these dynamics are important to those types of partners to know that you have something scalable. It's can be manufactured profitably, and has the ability to enter into a niche within the marketplace that is currently being unfilled. Next. Our team, as I mentioned, is over 40 people located throughout the United States. We have a very unique network of entrepreneurs and executives and residents. Some have been with us for almost 10 years now, as well as a group of analysts that John Nelson heads. And actually, we're like a virtual venture capital firm without a venture capital fund, able to provide all of those services, but we actually can do a much deeper dive with the clients we work with and the partners we're working with based on our mission and the experience that our EIRs have, which we're going to go into in a lot more detail as I progress. Next. As I mentioned, we're located in Rockville, Maryland, which is really the third largest biohealth cluster in the United States, following San Francisco and Boston. But our team is located throughout the United States. Reason for that is we're not only focused on working with Maryland, DC, and Virginia, but we've had long-term relationships with NIH and other organizations that are funding small businesses throughout the United States. And as a result, we've looked for the best and brightest professionals to become entrepreneurs in residence on the BHI team, regardless of where they are located. Next, John. We've had a 10-year relationship with the National Institute of Health in providing entrepreneurs in residence to their seed office now. And the seed office really oversees the SBIR program and the 27 institutes of NIH. Our EIRs are provided to work free of charge to SBIR funded companies, generally those that are closer to commercialization, have won a phase 2, and need regulatory assistance, clinical assistance, reimbursement assistance, intellectual property assistance, secondary or primary market research, introductions to key opinion leaders, introductions to venture capitalists, private equity investors. And so we've had this long-term relationship with NIH where our EIRs are working to support SBIR funded companies, but are on the BioHealth Innovation payroll. These EIRs, as I mentioned, are located throughout the country. And up until this year, the seed office of NIH was funding the travel of a lot of SBIR funded companies to Resi conferences, the Bio International Conference coming up in Boston next week. But this year they've had to put it on hold based on budget concerns and travel restrictions. And so their programming has been reduced temporarily until the longer term plan and budgets are identified for the NIH, which we hope will continue to be able to support the SBIR programs and the seed offices to the extent that they have in the past. In addition to NIH, John, next, we have a proprietary relationship with ARPA-H to provide entrepreneurs and residents to the Patio office. And the Patio office manages the SBIR program, as well as what was referred to in the past as broad agency announcements, BAAs, which are now ISOs, which were some of the larger grants that ARPA-H was funding. The SBIRs tended to be contracts for 3 years, about $3.5 million. The BAAs and ISOs, as Sam had mentioned, had ranged anywhere from 3 million and on the upper end, 40 to $50 million over multiple years. And we're seeing a small decrease in the size of those grants and the number of those being made by ARPA-H, as they're also waiting, just like NIH is, for the final decisions on budgets and programming. So we basically support the performers, as ARPA-H refers to it, by providing an EIR and an analyst to each of the performers to complement their SOW, their statement of work, which is focused on research and development. We do a work plan with ARPA-H, with our EIRs, to identify what the gaps are in their commercialization plans. Do they have are they getting ready to go to the FDA to file an IND? What other regulatory strategies do they need? Do they have a clinical plan for development of their technology or the research? Do they understand who's going to pay for their technology, and what are the reimbursement rates that exist today, or what's going to have to be done to create some type of a code with CMS for a new reimbursement rate from the federal government? And venture capitalists today are saying, who's going to pay for your technology? And it's extremely important to find out from a reimbursement standpoint where they stand. ARPA-H, we primarily began the work with small businesses, but are starting to get actively involved more with academic researchers who have received the ISO contracts from ARPA-H for early stage transformative technology. And what they've recognized is that they need access to entrepreneurs and residents actually earlier than when a small business would, who already identified that they want to go into the market. But the researchers at academic institutions have to evaluate whether there's commercial potential, what the competition is, and basically whether there is a path to go into the marketplace. So we feel that ARPA-H is the most nimble federal agency that we've ever worked with at BioHealth Innovation, and have demonstrated the greatest amount of flexibility in the contracts and the performers they're working with, as well as the vendors like BHI that are contracted to work with them. So we hope that this is sustained and grows within the federal budget. Next, John. In addition to federal agencies, BHI also works with tech transfer offices at academic institutions, basically in a way to look at validating their pipeline of patent technologies or their patent portfolio, also identifying which have the greatest commercial potential, which ones have the greatest potential for licensing, where a spin-out opportunity may occur. And a thing that we can offer that a lot can't is with our EIRs, we can actually provide fractional C-level experience, CEOs, CXOs, CTOs, CSOs, to these academic institutions who don't have that talent on board to actually create the starting team for these early stage spinouts. Next, John. As you look at our focus from a technology area, I'm not going to go through this, as I know we only have about 10 minutes left in this webinar, and I want to leave time for Q&A. BioHealth is all encompassing. It's not just biotechnology, it's diagnostics, devices, digital health, AI, machine learning, quantum, all converging today. Next, John. And if you look at our capabilities for commercialization with our EIR and BHI team, again, I won't go through every one of the bullets that you see here, but every one of these elements is necessary for a life science or a biohealth company to be able to manage and progress with if they're going to be successful in going to the marketplace, especially when we get into regulatory strategies, intellectual property, and differentiation that they have, as well as introductions to investors, help with pitch decks or presentations to make to investors. So I won't focus a lot of time here, but we will spend more time on that if anybody has any individual needs that we feel that we can help you with. Another program we have is an international soft landing program to help international companies that want to enter the U.S. market, don't know how to do it, don't have a significant budget, and would like to leverage our EIR teams to help them get their startups started or subsidiaries in the United States. And you can see the types of services we would provide to an international company. Next, John. One of the things that I do to try to keep up with the industry is I have a podcast called BioTalk, which we've been doing for about 8 years, and we've interviewed over 175 people. One of the latest, which just is published in our weekly newsletter, is Sam. And Sam's podcast came out on Monday and Tuesday. You can see it on YouTube, Spotify, iTunes, LinkedIn. And if you want to learn a little bit more deeply of what Sam was doing in his presentation, he goes more into depth into the current environment within the federal government, the future, and the services that Grant Engine can provide. I'd suggest that if you'd like to learn more about what Sam was talking about, listen to his podcast on BioTalk. So next, John. Last thing I'll talk about is we put on an annual forum in Rockville, Maryland, September 23rd, 24th, and 25th. It's our 11th annual. We'll have between 700 and 1,000 people attend over 3 days. We have a crab trap competition. We have an investor conference where we'll invite 50 investors and 100 companies to meet with one another. The registration for all of the events we have is free, and more information on this will be provided to those interested in attending, as we would welcome and be glad to meet with you if you can come to that BioHealth Capital Region Forum. And I'm going to close with that and thank Sam for the opportunity to be on the webinar with you today. We feel we are very complimentary to Grant Engine, as we're sort of, after you get the money, what do you do with it?
I'm listening to a webinar, so I only heard it in the background.
I'm sorry. So I will close with that and put it up for Q&A, Sam.
Yeah, great. Thank you so much, Rich. There was a couple of questions that came over for Rich, you and John. The first was, what stage of development does your product need to be in order to work with BHI?
Great question. We've worked with bench scientists that are early stage. We believe that it's extremely important to understand the commercial market as early as you can in your research that you are doing on the bench. We believe we can provide significantly greater assistance as the science progresses, getting to the proof of concept and into entry into the commercial at any stage, and we can evaluate at that point whether or not we believe we can be of assistance to you.
So, Rich, you were just cutting out a bit. So is it at any stage after proof of concept stage, you'd want to have a conversation and really confirm that you can be helpful? Is that what we heard?
That would be where we could be the most beneficial, Sam. As I mentioned, it might have cut out.
Okay.
We can meet with anybody at any stage and we have something we call EIR Day, and we'll do an hour with companies and entrepreneurs or scientists who would like to get a pulse on where their technology resides. They may not fit into our current sweet spot, but we give free advice to a lot of people, regardless of the stage they're at with their technology.
Got it. What would you, Narayag is asking, what TRL would that be where you'd want to engage?
Well, basically, if you're looking at TRL, we're probably looking at the second and third stages of TRL.
Okay.
And tech transfer offices at universities use the TRL a lot. And generally, once it's gone through the tech transfer office, they've done their licensing or they've done their patent protection at the tech transfer offices. That's generally when we would get engaged with somebody at the university level.
Makes sense. Yeah, perfect. And then there's been a couple of questions around the cost to do that. Who pays for that support from BHI?
Right. It's a good question. If you are fortunate enough to have gotten SBR funding from the NIH, you may be eligible for our EIR support through the seed office. We're also a TABA provider, which is Technical and Business Assistance Program, which NIH created, which the SBIRs didn't cover, which were regulatory, clinical, intellectual property, and market research. We're an approved TABA vendor to NIH, and sometimes SBIR-funded companies can get service through that. Otherwise, we would have to meet and determine what the scope of work and the work plan would be for what the needs of the entrepreneur or biohealth company would have, and we would do a customized proposal for them.
Right. Right. And then in terms of services, like maybe discrete engagements, I think we're getting a couple of questions around what are the services tactically, and I understand that to be things like an analysis around reviewing your investor presentation, a reimbursement analysis, regulatory. Can you just touch on the tactical engagement scope that you would provide?
Sure. We can go into a lot more detail, but actually we have experienced people from that have actually worked within the FDA, and say you have a therapeutic drug that is in research and you want to go for FDA approval. Our entrepreneurs and residents can go through every element that is required to be prepared to have discussions with the FDA. Our EIRs will partner and have discussions with the FDA members talking about next steps. Will assist in the development of all of the forms that need to be completed for submissions to the SBA. So we can go as deep as needed, for example, in a regulatory environment. If it's related to intellectual property, we have intellectual property lawyers who can do all of the basic initial searches that need to be done on the technology. We will do secondary market research. We can do primary market research, where we can actually do interviews with key opinion leaders or potential customers for the science or the technology that is looking to get into the marketplace. So we can do very basic competitive analysis. We can assist in pitch decks. We can do introductions to strategic venture capitalists or strategic partners or investors that may be interested in that science or technology. So from a tactical standpoint, we can do deep dives in almost every area that we listed there under the EIR capabilities, Sam, because We have a unique network of EIRs who have broad industry, entrepreneurial, R&D, FDA, reimbursement experience to meet basically the needs of anybody that's going into the biohealth or the life science industry.
Yep, got it. Okay. I think there's a couple more questions on like where prices start. I would say, I don't know if you've got any initial views that if you want to share now, or they should reach back out to send a quick email.
Yeah, I think that, to be honest with you, pricing is so personalized that it would make more sense. I'd be glad to have an individual discussion with John and myself, with whomever's asking that question, with no commitment whatsoever, no pressure. And we'd be glad to analyze what their needs are and determine, really, it gets down to the amount of time required and the resources that would be needed to fulfill the task that they're asking for.
Yeah, great. Okay, sounds good. And Scott, I asked for a clarification on what you were curious about in the chat. Also, feeding back on earlier questions, if you have noticed, there we go back. If you're curious about the indirect rate question, that was asked of us, do you recommend 40 or 15%? We've answered that in the chat. You can also find our webinar from April 2nd on Grant Engine. If you go under resources and then events, if you go to the calendar, pull down that webinar, you can access the April 2nd. That'll give a lot more detail on that. But the short story is, until we get definitive guidance, we are recommending maximize your chances of dollar award and minimize your chances of something getting ripped out. And what that means is, be ethical and appropriate about putting whatever was traditionally classed as an indirect into direct, and put your indirect at 15%. I honestly think it's going to be back at 40, but prudence is the better part of valor. So make it 15, ethically and appropriately load up your direct with what specifically has been indirect, and we can help navigate that in an engagement if we wanted to go there. So that's our guidance there. And Caroline had asked, how is the submission of non-SBIR grants by industry, i.e. POVs? I think that's asking is what happened in 24 and 25, and other agencies have not yet released their win rates, and they don't really do so longitudinally the way the NIH does. So there's not great data on non-SBIRs to date. But as that comes out, we are going to report out on that. So that's that. Yeah. Okay. So yeah. Thanks, Scott. I think those were all of the questions that we had. Yeah, you had asked, Sana. Hey, good to see you, Sana. Global funding opportunities. So there's Cancer Research UK. There are a lot of European funding opportunities. There are, for companies that are based in Australia, there's Australian grants. So a number of them require some kind of European presence, which is the antithesis of what the SBIR program wants to be and do. So it can really depend on what your tech is and where your team is geographically located. But there are also nonprofits that are outside the United States that want to realize a mission, and they see the value of US-based companies, and that they generally would be more allowed. So we have a solicitation search that can help unpack that as part of our find solution in our spectrum of find, win, manage. So that's a vehicle to do that. Another really attractive place is state-based funding. When you engage with us to do a solicitation search, we can get you your state-based resources And for existing clients, that's all complementary and part of the relationship. Steve is asking, does BHI work closely with Grand Engine to identify funding opportunities that would cover the expenses required for BHI services? Yeah, as John responded, that's a good question. And the short answer is absolutely yes. We are always philosophically and tactically aiming to get you the most amount of budget award possible, right? That includes maxing out the budget. It also includes, and again, this is for appropriate expenditures. We're also geared towards identifying technical and business assistance, that TABA line item that is incremental to the budget amounts. And BHI can be a partner to do those things that you would call for either in the project, but also in TABA. So we naturally work well together. We have socialized with our program managers that build the budget with you and for you on an engagement to be mindful of what BHI can do, so it gets baked into the grant. But yeah, I think we're here to give you that right partner, and BHI can do a lot of really important things and there are others that can do other things like clinical trial work, formulation, CMC, and sometimes more specialized regulatory work. But the bottom line is we're very mindful about BHI's great capability, and we're gonna spec in BHI often because they're a great partner, and the budget would then naturally pay for that work. But if you also have, as Rich mentioned, if you have an award, they've got one of the few programs that have gotten renewed through and past the fiscal year end is one of the seed budgets, the seed budget, and BHI is part of that. So there's some good news in terms of longevity and security in a turbulent world.
Yeah, Sam, I just add on to that basically that if somebody gets an ARPA-H contract, there's no cost for any services BHI would provide to any performer that is funded by ARPA-H. So that is something that, go for those ARPA-H awards, because with that, you can hopefully get BHI as a provider to you and not have to pay for those services because they're absorbed by ARPA-H. And then the seed office, basically identifies those SBIR award winners that need assistance, that they feel have good commercial potential. And generally, that's where the EIRs that are working, the BHI EIRs that are working at the seed office or NIH, other institutes, are actually devoting their time and attention to. And there's no cost if you get recommended by the seed office as a BHI EIR to work with you as an SBIR funded NIH company. There's no charge for those services either.
Yeah. Great. We're just past the hour. And I'll just finish by saying thank you. Senna, you had asked where you can find the ARPA-H solicitations. For the ones that have already passed, they're on the website. For the 17 program managers that are hired, working on programs but not yet announced, those are not yet public. They've not been published, but we have their names and what areas of field of study they're generally working on. Some of them we've interacted with and we know where they're headed as a program, and we can help guide you there. So reach out to us if you think ARPA-H is in the cards for you, and we can help align who those are that are not yet announced, and that's the right time to be working with them and building with them. So just dialogue back to us, Senna. And Senna, I'd sent you a personal message as well. It's good to connect. Let's try and have chat on email if we can. So anyway, for everyone else, thank you very much for participating. If you want to have anything else answered, please reach out to us. We're here, and please stay the course. There's good opportunity here. So with that, I will say thank you all for participating, and for the Grand Engine and BHI team, we'll do a quick roundup offline. So thanks, everyone. Have a wonderful week and be safe.